Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power, real control, and so that you can influence decision making, even if you're not a doctor or a nurse in intensive care. In last week's blog, I showed you what you need to do in the first few hours after your loved one has been admitted to intensive care. And if you haven't read, watched, or listened to the update, you can check it out by clicking on the link. In this week's blog, I want to talk about how you and your family are perceived is directly linked to the care your critically ill loved one is receiving or not receiving in intensive care. After having worked with thousands of patients and families in intensive care in more than 15 years intensive care nursing, it has given me tremendous insight into the world of intensive care, and I have learned many valuable lessons. One of the biggest lessons that I have learned in intensive care is that what you see is often not what you get. I have actually written a blog post about it, and you can click on the link on the blog. This is sad but true, and more often than not, the treatment and the care, and even the prognosis and diagnosis of your critically ill loved one is dependent on how you and your family are perceived by the intensive care team. Let me say that again, because it's very important that you understand that the perception that other people have of you and your family is directly linked to how the intensive care team may position your critically ill loved one's prognosis, diagnosis, and the perception that the intensive care team has about you and your family is directly impacting on the care and treatment your critically ill loved one is receiving or not receiving. Let me give you a real-world example here. Deborah is a 47-year-old woman who has just been admitted to intensive care with pneumonia after she had recent chemotherapy for leukemia. The pneumonia has been a direct result of the chemotherapy for leukemia, and her body just couldn't keep up with the chemotherapy any longer, and she ended up getting pneumonia, which can be quite common after having chemotherapy. On the ward, Deborah had difficulties breathing, and she required increased amounts of oxygen to the point where the ward staff felt Deborah couldn't be managed safely on the ward any longer, and Deborah needed admission to intensive care. Fast forward, Deborah got admitted to intensive care for management of her now severe pneumonia in light of her leukemia and recent chemotherapy. The intensive care team knows that the 20-bed ICU in which Deborah is being admitted to has a shortage of beds already, as many other patients are awaiting for those beds as well, and generally speaking, if a patient with pneumonia after chemotherapy for leukemia is being admitted to intensive care, the odds are often against the patient, and the intensive care team also knows turning the odds around would take a significant investment in time, energy and resources. The intensive care team knows that it's not impossible, and they have seen it in the past, that patients admitted to intensive care with such a prognosis can get out of intensive care with the pneumonia being treated successfully after mechanical ventilation and an induced coma. In Deborah's case, the intensive care team is fully aware that putting Deborah in an induced coma and ventilating her for a few days and commencing her on antibiotics may well send Deborah off in the right direction. However, the intensive care team also thinks that maybe not ventilating Deborah and only putting her on BiPAP or non-invasive mask ventilation may prolong her life but may not necessarily cure her pneumonia, and in fact she may therefore die in intensive care. Deborah's family has trust in the intensive care team, but they also have no idea on how the odds are stacked, nor does Deborah's family have any idea that the demand on the ICU beds is very high, and that the intensive care team knows that treating Deborah with ventilation and an induced coma would take up a lot of time, energy and resources in their ICU, and the intensive care team is not prepared to invest the energy, the time and the resources. Deborah's family is completely oblivious to the moving parts behind the scenes, and they are completely oblivious to how and why the intensive care team is suggesting to Deborah's family that BiPAP or mask ventilation is the way to go, and they also hint that Deborah may not survive her admission to intensive care. The intensive care team also has the perception that Deborah's family doesn't really know and doesn't really understand what the treatment options are, and they therefore feel that not mentioning ventilation and the induced coma, and therefore increasing Deborah's chances of survival, is probably the right way to go. Deborah's family in this instance is being perceived as weak, not knowledgeable, and they are not perceived as a family with power, influence and control. The family is at the complete mercy of the intensive care team. The intensive care team also knows that Deborah's family feels intimidated by the intensive care team. On the other hand, if Deborah's family had an understanding of what's really happening in intensive care, and if they questioned the motives of the intensive care team, and if Deborah's family was positioned as someone who knows about the moving parts, the politics, the intrigue and the motives of the intensive care team, they could change the perception that the intensive care team has about the family, and Deborah's family all of a sudden is perceived as a family who is knowledgeable and who has influence, power and control over the outcome of their loved one. That family is not at the mercy of the intensive care team. The family also questions the motives of the intensive care team and asks specific questions about their loved one's treatment, because they have informed themselves and they are therefore not intimidated by the intensive care team. And if anything, they see themselves as equals, and they therefore have control, power, impact and influence. How can you get control, power, impact and influence? Well, you can get that by, and if you want to be perceived as strong, influential, impactful and knowledgeable by the intensive care team, and if you want to be in control of your and your critically ill loved one's destiny, and if you want to make an impact, download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll also learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability. You get 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get behind the scenes insight so that you understand what's really happening, and how you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact Report, you'll also get 4 other free reports, and the reports you will be receiving are: the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you're not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's update, and I hope that this episode has helped you how you can change the intensive care team's perception about you, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.